It has been 1 year since beloved Friends actor Matthew Perry sadly died at his Los Angeles home at the age of 54. After struggling for decades with drug and alcohol addiction, Perry's death was eventually put down to acute effects of ketamine. But what has since occurred has been a tangled web of investigations and questions into how the actor managed to ingest so much ketamine and what type of people he was surrounded by at the time of his death. Since then, 5 people have been charged in relation to his death, including 2 doctors, an alleged drug dealer, Matthew's assistant, and a man named Eric Fleming. 2 of the charged will face trial next March. Joining me now to discuss 1 year since Matthew Perry's death, including everything that we now know, is Dr. Raj Persaud. Raj, one of the updates from the investigation began into Perry's death in May, and that is that they uncovered a broad underground criminal network of drug suppliers who were distributing large amounts of ketamine around. From your knowledge, how popular has ketamine become that is leading to actual doctors committing crimes to distribute it?
Well, ketamine was first discovered or uncovered quite a long time ago, about 40 to 50 years ago, and has been used legitimately, widely as an anesthetic. It became a drug of abuse about 20 years ago. Analogues of the drug, similar structural drugs like phencyclidine or PCP or angel dust, were quite famous back in the 1980s. Angel dust features for a little bit in one of the film's Trading Places, for example. Drugs similar to ketamine have been around for quite a while. It's used legitimately in hospitals as an anesthetic agent. A remarkable new investigation and research very recently found that a single infusion of ketamine had a remarkable, powerful, almost instant antidepressant effect. So a lot of research interest and clinics have sprung up, and the FDA, the Food and Drug Administration in the US, have licensed a form of ketamine as a legitimate treatment for depression. But certainly for a long time now, it has been a drug of abuse. Interestingly, given Matthew Perry is said to have died partly from an overdose, actually, it's very rare for people to die from overdoses of ketamine. Usually, what happens is something else happens, like an accident. And maybe one of the problems here is that Matthew Perry was in a bath, in a swimming pool, in a hot tub. And maybe one of the reasons he died was the acute unconscious or conscious altering effects of ketamine meant that he drowned in the hot tub. It's still an open question as to exactly what happened. The inquest also said that one of the effects as to why he might have died was cardiovascular effects. That may have been due to the fact that he was perhaps and is alleged a poly substance abuser, and his body may have suffered as a result of other drugs he was taking at the time.
Raj, you mentioned this, but Matthew Perry, he actually had been undergoing ketamine infused therapy, which is that legal treatment for anxiety and depression and pain that some people might use. But the coroner concluded that this therapy was not the reason for his death, this legal therapy, which means that the level of ketamine that was found in the actor's system was much higher than what would be in his system had it been related to that therapy. So what do we know about how much ketamine was in the actor's body that could have been used recreationally?
Well, much higher levels were found in his body than would be expected, given actually ketamine given as a treatment for depression is given in quite a low dose. The other thing that's really interesting is not the high levels, but also the fact that so many people seem to be surrounded and have been charged. 2 doctors have been charged, Dr. Mark Chavez, Dr. Salvatore Placinia have been charged. This woman who's been referred to as the ketamine queen, Jasveen Sangha, his assistant, Kenneth Iwamasa, and this other chap, Eric Fleming, who appears to have run a drug rehab clinic, but may have been, it is alleged, have supplied ketamine as well. So the fact you had so many different people involved suggests that basically what was happening was Matthew Perry was being supplied with large amounts of the ketamine from various different sources. He seemed to have an almost inexhaustible appetite for the drug. And famously or infamously, the two doctors are meant or alleged to have exchanged had a text exchange along the lines of how much will this moron pay for these drugs, and a text exchange which was, let's see how much we can get into him, basically. So
Mm.
the very fact you had so many different people and so many different routes of the passage of the drug towards Matthew Perry suggests that he was taking really, really very large amounts.
Raj, these two doctors that have been charged, they knowingly gave this much ketamine to a person, knowing as a doctor how much is used for legal therapy, and then illegally obtaining more ketamine for the star, which was worth about 50,000 US dollars in just the few weeks before his death. So these doctors knew exactly how much ketamine this actor was going to take.
A lot of doctors are driven to have celebrities on their books because it's one way of having kudos, it's one way of establishing a reputation, it's one way of attracting other patients. And as a result, some of those doctors find it very difficult, and I'm not defending their behavior is reprehensible, but they do find it very difficult to say no to a celebrity. Because if a celebrity is asking them for more and more substances that could be prescribed legitimately, but at higher doses really are being used for an illegitimate reason, that doctor says to themselves, well, if I don't give them the drug, they'll get it from somewhere else. So
Mm.
there are lots of reasons why doctors to celebrities find it very difficult to draw a line, draw a border, and say no. In other words, tell the patient what they need to hear as opposed to what they want to hear.
Oh, absolutely, Raj. But you know, he's still risking his, his medical certificate and right to work, which has now been suspended. Both doctors. So, but Raj, according to prosecutors, in just the 4 days before Matthew Perry's death, he was administered 27 shots of ketamine by his assistant, who was taught by Dr. Salvador Palacina, who will face trial next March. What does that amount of ketamine do to someone's heart?
Well, there's a lot of evidence it can raise your blood pressure dramatically, can also slow your pulse rate, so it can be dangerous to say the least. The other thing that I think is really interesting about this is the doctor apparently trained Kenneth Masa, the assistant to Matthew Perry, to administer the injections. And that's a clue about how this was out of control. In other words, normally what you'd expect is the doctor to turn up and administer the drug because it's an intravenous or intramuscular drug. And really, that should only be done by a doctor or a qualified clinician. And the fact the doctor trained the assistant to start delivering the drug suggests how out of control this was. In other words, the doctor couldn't turn up often enough themselves.
Mm.
We still don't know to what extent was it the actual drug and the high doses, or to what extent was it caused Matthew Perry to become unconscious, had cardiovascular effects, and then Matthew Perry drowned because he was unconscious and in the hot tub, and also unsupervised. The assistant leaving also, I think, will be found, though we don't know what's going to happen in the court case, as again the kind of thing that someone who's not medically trained. I don't think a doctor or a clinician would have done that. Would have left a patient unsupervised, having administered such a large dose. But again, obviously, this is speculation, and we don't know what the court case is going to find.
Yeah. And that indictment details that Perry was given those 27 shots despite the fact that the month before he had ingested so much that he was detailed to have gone frozen. But doctors still left those vials of the drug for the actor and his assistant to administer. How dodgy does this entire thing sound to you?
It does sound obviously extremely dodgy, but it also sounds like it was going on for some time. And the problem is, as people cross a threshold, from my clinical experience working with celebrities often involved in this kind of unfortunate situation, you get into a spiral because they have done a certain dose and done it seemingly safely for a period of time, and then they up the dose, and then they up the dose, and then they up the dose, and then something disastrous happens. The
Mm.
other terribly ironic thing to say about this is his vulnerability. We don't really know the fine details of what his personal life was like at the end, but it does sound to me like he was very isolated. And my experience, again, dealing with many celebrities, is you'll be surprised how lonely and isolated they can become as a result. Perhaps partly of their fame, they don't trust people around them as to what they're after. And in the end, the drug dealer or the supplier of the drugs becomes their only friend because the drug dealer will bend over backwards, obviously, to be very friendly. And lonely, isolated people are very vulnerable. And you'll be amazed how lonely and isolated many celebrities can become.
It did seem that these five people were taking advantage of the actor for monetary gain and conspiring against him in some way. But Raj, with that much ketamine inside of Perry, how would he have been feeling on that day on October 28th last year, before he tragically drowned in the hot tub?
Well, again, we have to speculate. We do know that ketamine can produce a rapid alleviation of depressive symptoms when it's used clinically and therapeutically under supervised conditions in a medical clinic. And we also know that maybe that was one of the routes by which Dr. Salvador Placinia was getting the drug via Dr. Mark Chavez, who appeared to have run at some point in the past, it is alleged, a legitimate clinic where ketamine was given legitimately. So that may have been one of the routes by which the drug was being passed through to Matthew Perry, but obviously at much higher doses than the therapeutic routes. So we know it can alleviate depression. In much higher doses, it produces a dissociative state, is what it's referred to, where people disassociate. In other words, they don't feel really very present or in contact with the world, but they are awake. And for many people, that can be a very pleasant experience. What's very interesting about the connection between that state of dissociative anesthesia and also the fact there's a treatment for depression is it does look from the very preliminary research findings we have that ketamine seems to almost rewire the brain and disconnects the brain from traumatic memories. And that may be why it's so effective as an antidepressant.
Raj, just finally, you mentioned doctors taking advantage of various vulnerable celebrities. We saw that with Michael Jackson in 2009 when he died, and his doctor was charged with his death and supplying those drugs to him. How, with the trial taking place in March next year and Matthew Perry's family coming out saying you're going down to the two people that will face the trial next year, how important is it for these doctors to take responsibility and face the consequences for leading, an actor to his death by providing him with this amount of drugs?
Well, obviously, these doctors may be found ultimately to have taken part in criminal activity. And we tend to think of doctors as being upstanding citizens. It takes a long time to pass all the exams through medical school. So it's generally speaking regarded by the public quite rightly, I think, as quite rare to find doctors who are not committed to looking after patients, in terms of their best interests. So this seems like a million miles away from what we'd expect doctors to do and behave. However, having said all of that, when very large sums of money are involved, I'm not again defending these doctors' behavior. I think it is perhaps more easy to see why some doctors will break the Hippocratic Oath, take the money, and do things that are very dangerous for patients. The other delusion that I've seen in my clinical experience that doctors believe they know better than a drug dealer on the street how far to press it. They know, because they know medicine, what they think the patient can take. And again, it looks like the text message exchange between these two doctors that they were kind of out of control in terms of being focused much more on the money than thinking about the patient's own interests. I have to emphasize, I think that most doctors are not like this at all. Many doctors I've seen in my clinical practice in Harley Street walk away from large sums of money that are being offered to them by celebrity patients to do something dangerous. So I don't think the press has gone big on the fact that, how could these two doctors do this? I do think that this is very, very rare behavior from my clinical experience of doctors for them to end up in this situation.
Of course. Dr. Raj Persaud, thank you so much for your time today.
Thank you.